Hello, and welcome to the Brain Injury Association of New York State's webinar, So You Want to Be an Advocate, Federal Overview. I am Judith Abner, Executive Director of the Brain Injury Association of New York State, and thank you for joining us today. Before we begin, a few housekeeping details. Because of limited time, we ask that you please hold your questions until the end of the presentation. During the question and answer session, questions can be submitted via the question text box. The text box option should be visible to you on the GoToWebinar toolbar on your desktop. If you are having trouble viewing this option, please contact Citrix Tech Support at 1-800-263-6317. Again, that number is 1-800-263-6317. This number should also be visible on your toolbar. Our speaker will do her best to answer questions in the order in which they are received. Any questions that she is unable to address may be submitted through email to the Brain Injury Association of New York State. We will be recording this webinar session and plan to post it along with the PowerPoint slides and additional resources provided by Susan to our website, www.bianys.org. Information about contacting the association and viewing the webinar will be provided in a follow-up email after the presentation has concluded. Before I turn the microphone over to Susan, let us begin with a quick poll to see who is in our audience today. So please take a moment to answer the question.
The poll is open. Please take a moment to answer. I will be closing it in about 10 seconds. All right, I'm going to close the poll now and share the results. It looks like 32% answered that they are a healthcare professional or provider. 5% answered I am a person with a brain injury. 14% answered I am a family member or friend of a person with a brain injury. And 50% answered other.
Always interesting to know what the other category includes, but it's clear that there's some variety in our audience today, which is wonderful. And again, I would like to thank you all for your participation and for helping to spread the word about our webinars. And so now it is with sincere pleasure that I introduce our webinar presenter for today, Susan Vaughn. Susan is a consultant with the Brain Injury Association of America on state and federal policy issues, and also Director of Public Policy for the National Association of State Head Injury Administrators, of which she is a founder. She has co-authored 2 articles on public policy and has nearly 29 years of experience in the field of disabilities and policy, and has been a long-term friend and colleague. And so I'm especially pleased to have Susan here with us today to share her information, insights, and suggestions, and also her incredible passion for having people be involved in advocacy on the federal and on the state level. So without further ado, Susan, welcome and thank you again.
Oh, thank you, Judy, and good afternoon to those of you in New York, and good morning to those who are in the other parts of the country where it's still morning. I'm happy to be here today to talk about federal legislation and Congress and what we can do to advance issues for people with brain injury. For as long as I remember, it seems like every year is a crisis. You know, budgets are being cut, grants are being block granted, we're privatizing, we're laying off. It just seems like we always have this sense of crisis. And I would say this year is probably no different as we talk about the budget and the debt, et cetera, at the federal level. But I'd like to take 1 second to talk about the half glass that's full. I think we forget sometimes how far we've come along in advancing policies. And when I think about when Judy started and I started back in the 80s, we were just now working on seatbelt legislation and making the correlation between traffic safety and traffic injuries and brain injury. And look where we are now. Certainly the military with war-related injuries has brought another focus to this country around brain injury. We are now hearing the discussions on football-related and sports-related concussions. I heard the president comment it yesterday, and to be politically correct, I even heard George Will talk about it on Sunday when he said he'd be glad the day came when sports newscasters would talk about concussion and brain injury and not say that he got his bell rung. So I think in a lot of respects we've done a great job in trying to enlighten the public on the terms and what brain injury is, concussions, and what the causes are. I still think we have a lot of work to do to talk about what the consequences are and the long-term consequences. And that came to my mind when I heard some of the discussion with Secretary of State Hillary Clinton, who had the fall, and many people were doubting whether she could have a concussion from a fall and why would she have any problems. So it still behooves us to be in this arena to educate people around brain injury and around the causes of injury, what the long-lasting conditions are with regard to injuries, and to talk about what is the role of federal and state government. This is discussion that does disturb me a little bit when I hear the people talk about, or our elected officials talk about, we need to downsize government, we do not need the role of government, because I do think we need some protections and some safety nets for people. So this is where I'm hoping that this session will lead us, will inspire you to feel like you can help make a difference and help us to make sure we educate our policymakers all up and down the spectrum on brain injury, the causes, the consequences, the lifetime consequences, and what can we do to make sure that people can return to school, work, and home after injuries. So with that, I will tell you that today I plan to do a brief overview of Congress. This is what I call a quick and dirty presentation of Congress. It's just to provide the framework from which we work in if you are working on federal policies, what is the legislative process and how that relates to brain injury, what is important in that process that we need to know, and then lastly, how to advocate to benefit New Yorkers with brain injury. Although I will say, since there are other people on the call from other states, this also pertains to working with all individuals with brain injury. So I'm hoping that these tidbits will help you in all parts of the country. And to start with, Judy gave you a poll, and we thought it would be good to know, have you contacted your congressional delegation in the past year about brain injury issues, yes or no? And we would like to have a few minutes to kind of gauge the involvement of our audience.
All right, the poll has been launched. Please take a moment to answer. All right, I'm going to close the poll and share the results. Susan, it looks like 40% answered yes and 60% answered no.
Good, good, good. Thank you. And excuse me. All right then. Hopefully by the end of this session we'll have 100% who will be ready to take on our members of Congress to talk about brain injury, and you'll feel comfortable to do so. Just to give you a little overview about Congress, we are in now the 113th Congress. That is the number we're in. It just started. You all saw the inauguration probably last week with the President. And then members of Congress convened the new Congress and were sworn in January 3rd. I see where New York Brain Injury Association, or this Brain Injury Association of New York State, is having a session later on New York State legislation, or a similar type of webinar only dealing with state issues. And I'll say that as you think about Congress, there are always similarities between the states and how state legislatures work and how Congress works. There's always some nuances and some differences, but a lot of states have adopted the way they govern based on some of the way that Congress governs. So as with 49 states in this country, we do have a bicameral system. We have two bodies, House and Senate. And in case you're wondering, Nebraska is the only state that has a unicameral system. Our sessions are 2 years. We have a first and second session. One thing that Congress does is that when bills are introduced in the first session, they carry over to the second session. That's not true with all states. For example, in my state, in Missouri, when we say sine die at the end of the first session, it really is sine die. All the bills die, and they have to be reintroduced the second session and start all over. But for Congress, the bill that's introduced today, and it's not yet passed, can still be passed next year. So that is something to know, that it does carry over. In February, on February 12th, we have a joint session where the President makes his remarks. It is a little bit later this year, and so is the President's budget. That is something that most of us that are working on national issues are anxious to see, is the President's budgets and recommendations. So we know then how to tailor our message to members who may want to contact people to know what the message is. So is the President recommending increases in program? Is he recommending decreases in programs? We don't have that blueprint yet. But when the President's budget comes out, it will tell what his recommendations are with regard to the administration programs, any changes he's proposing, any increases, decreases, and any revenues that he's anticipating to find through any kinds of proposals that he may be offering to increase or decrease revenues. So that is kind of the overall picture of Congress. We have 435 members of Congress. This is the distribution if you look at the dot points, how they distribute between the parties. We have 2 seats undecided. People have left their position. We have a congressional member in Missouri who is also resigning soon, so we'll have a special election in June for that seat. But for New York, you have a large delegation with 27 members. I did put together a list of all your delegation, both your representatives and your senators. I have the office addresses for Washington, D.C. listed and all their in-district offices. If you do not know who your representative is, you can go to this website, www.house.gov, and plug in your zip code, and it will tell you then who your U.S. representative is. And then it will take you to the website. If you want to go to the website, and on the website you can find the information with regard to their Washington office and with regard to their in-district offices. They all have an in-district office so that they're able to have people within the district back home that can work on constituent issues, help with arranging meetings, etc. back home. So there are a couple ways that you can make contact with people. The House and the Senate are much like any organization, and that they do have elected leadership positions, and the majority party and both get to determine who the leadership is. In this instance, in the House, the majority party is Republican, and that's John Boehner. I listed some of these key people on these slides for both the House and the Senate, partly so you can see who is in the leadership positions. And if you come from states where you see that you have a representative or senator in a leadership position, that's really critical, and that might help you to know that you should be letting those folks know about brain injury, because they will be in a position to help. The Speaker of the House, John Boehner, and the Republican leadership, they have a little different issues this year under this Congress. than in the last Congress than in previous years, and you've probably heard all of this on TV. I work out of my home, so I have the news on all day, and I probably hear too much of it. But there is a little rancor within the leadership where it's not real cohesive, and so normally they would try to have the whole Republican caucus vote for legislation to get legislation through, but they're having trouble with holding their caucus together. So that's been kind of something interesting to watch. On the Democratic side, the leadership is Nancy Pelosi. You may recall she's the first woman to be the Speaker of the House when the Democrats were in charge. And again, you can see the positions and who holds those. And then if you're wondering what a Democratic whip, what a whip is, you have a whip in each of the party. It really means what they do is they round up votes. So when they're looking at legislation, they're wanting to see, do they have the votes from the Democrats? Do they have the votes from the Republicans to get legislation through? What is the position of their caucus? So a whip is kind of a vote counter. They're up whipping up votes, and if they're wanting to push something through or defeat something, they're up there whipping up their party to make sure that they're all sort of in line or in agreement. Just like most organizations, you have committees that handle the work. I will say, I meant to say rather that with Congress they do have parliamentary procedures. I was always taught they had used canon rules, and the reason I was taught that is because that's the rules that Missouri uses with their legislature, the canon rules of order. Which is another way of doing business, like Robert Rules of Orders, only you have canon rules of orders, and that deals with motions and amendments and parliamentary procedure. And I'm assuming they still do that. I actually looked it up to see if that was still true. But instead, I looked at the history of all the rules. They have a rules committee, and at the beginning of each Congress, you will have the House and the Senate that will adopt rules for how they govern. It's not parliamentary rules. Mostly it's rules around maneuvering legislation. So, for example, you may hear on TV in the last, well, I guess when they did the fiscal cliff vote, you might have heard people say, well, he's not using Hassert rules. Well, Hassert rules has to deal with the Speaker of the House when Hassert was there, and his rule was that you wouldn't take up any legislation unless the majority of the majority party was for it. So in the case of the fiscal cliff vote, the majority of the party, which was the Republicans, were not for it, but they had enough along with the Democrats to pass the bill. But they called that the Hassert rule. So that is something that the Rules Committee in that Congress had abided by. John Boehner has a rule now that with regard to spending cuts, that whatever the spending cuts are that has to deal with the debt, they have to be equal to the size of the debt ceiling. So, you know, they have these rules that are not necessarily like passed on from Congress to Congress, but they look at how the rules are for governing legislation, really. What I've done is listed the House committees. There are a lot of House committees because there's a lot of House members, and they have plenty of people to do work. So all these committees also have subcommittees on them. And I've highlighted in yellow some of the key committees with regard to brain injury. Obviously, Appropriations is important. The Armed Services Committee deals with the Department of Defense, and often they have legislation now relating to health care and relating to brain injury. The Education and the Workforce Committee has subcommittees on it that not only deal with education and would deal with special education, but they also with vocational rehabilitation, would deal with Workforce Investment Act. Your NIDER programs is funded under education, so anything that kind of comes under that purview of education and vocational rehabilitation job training programs would be falling under that committee. I highlight it because the last few years Vocational Rehabilitation Act and the Workforce Investment Act have been up for reauthorization, and that is the committee of where that work is. The Energy and Commerce Committee has a subcommittee called the Subcommittee on Health, and that is the committee that will look at Traumatic Brain Injury Act legislation, and any health-related legislation is going to come to that Subcommittee on Health committee first before the overall Committee of Energy and Commerce committee. So, you know, generally what happens is the subcommittees review and mark up the bills, and then they'll go to the broader committee, the big committee, and then they would make their markups and vote it out before it went to the floor. Now, one reason I highlighted that is not only because we're interested in it, but also so that if you go back and look to see where your members of Congress are, see if you've got anybody from your state that are serving on those committees. Certainly, all members of Congress are important, but if they're on key committees of where you've got interest, that's even more important to make sure they know what your issues are. These are some more of the committees. Again, I highlighted the Transportation and Infrastructure Committee. That is where the big transportation bill is. Most people think of that as the concrete bill because that, you know, builds highways. But it's also where our highway safety funding is that supports the safety initiatives, and in some states they will contract with Think First Project, Safe Kids, and even maybe the Brain Injury Association state affiliate to promote awareness around traffic safety. It's also accessible transportation issue, mass transit systems, which you on the East Coast would certainly be much more attuned to than someone like me that's sitting here in the Midwest. So that's another committee that I think from the brain injury community we like to pay attention to, because ultimately those funds come down to the state level and then programs are carried out at the state level. And then the Veterans Affairs Committee, I think, speaks for itself. That's the committee that looks at the department programs, and they have passed legislation in the last few years around caregiver programs and to improve programs and services for people with disabilities and people with brain injuries. This is the Appropriations Subcommittee. As I said earlier, these committees all have subcommittees, and the subcommittees deal with the budgets of the certain federal programs and the federal agencies and the federal programs within those agencies. So again, Defense Appropriations actually appropriates the money. They're the ones that appropriate the money for the DV-BIC program, the brain injury program, and will appropriate money for health-related programs that are carried out by the Department of Defense. So we do pay attention to that a little bit. And then the big committee is this Labor, Health and Human Services and Education-Related Agencies Committee. It's often referred to as the Labor H Committee. And as you can see, you look at all the programs, you can tell that would be under that heading. That's all of Health and Human Services. That's all of the education programs that are under there. And it is the bill that usually gets hung up in the appropriation process. You know, Congress will deal with Homeland Security. You know, they will deal with transportation because that's state money. That's money that goes to the states to build highways and infrastructure. They will deal with some of these agencies, but the Labor H tends to be the bill that will get hung up in the process that people cannot agree to. There's a lot of money in that bill now as a result of the Affordable Care Act. That tends to be controversial. There's money related to all kinds of things that tend to get it hung up. It's just a big bill. I mentioned the chairman this time because it has a new chairman, and that's Jack Kingston from Georgia. I don't know too much about him, but I've seen him on Bill Maher. I don't know if you all ever watch Real Time with Bill Maher, but I've seen him on there, and he seems like a nice, congenial guy. But I don't know too much about him in terms of what he supports in that program, with regard to the agencies that fall under his jurisdiction. The other dot point, of course, is the military construction, the VA. The VA related, that's funding for VA, which includes Veterans Affairs Health System. And then again, down below is where the actual money is for transportation. And then HUD, for many people with disabilities and advocates, the HUD funding is something that people pay attention to because that's where your Section 8 disability housing vouchers are. and assistance to help people with disabilities get housing. And the last couple of years, with Health and Human Services putting a lot of resources and emphasis on developing community alternative and living for people with disabilities, they have partnered with numbers of agencies to try to promote that. And one of the things that's resulted is out of Health and Human Services and the Medicaid agency, they are partnering with HUD to kind of promote how you can collaborate at the state level to make sure housing is available for people coming out of nursing homes that need a place to live. Let's see, did I want to say anything else about that? I think that's all I wanted to say about the House. I want to switch to the Senate and give you a kind of overview of that. You know, there's 100 senators. They have 6-year terms. The House has 2-year terms. So you know they're already talking about 2014 elections, and we just finished an election. But a third of the senators will be up for election in 2 years as well. They have staggered terms. And there's a number of senators you've been reading in the paper that are retiring. So we'll have a chance to have some new folks over the next few years. Your senators, of course, you know in New York, they're here, and their information is in that piece of material that I had posted that gives you your office and contact information. And then in the other states, if you don't know your senator or you don't know how to contact your senators, you can go to the www.senate.gov website. There's a tab at the top that says Senators, and it will really take you to this link that I have in parentheses. And so then again, it will just take you to their webpage, and then you can find out their office information, their contact information, emails, and district information. On the Senate leadership, the president of the Senate is the vice president that is constitutionally mandated. He really doesn't vote in the Senate except for when there's a tie vote, and then he can break the tie. The president pro tempore, or we would say president pro tem, abbreviate it, is Patrick Leahy, and that goes to the senator with the most seniority of the party. So in the Senate, the Democrats have the majority, and they're in the leadership positions, and Patrick Leahy from Vermont has that title. Again, these are your majority party leaders. I did highlight Chuck Schumer. He's in a leadership position. I see him on TV all the time. He seems to be involved with all the key issues at hand. I might note, too, I don't know if anybody's on there from the state of Washington, but Patty Murray is a good supporter of brain injury. She's been on the defense committees and asked questions, or armed services committees, and asked questions around military and brain injury. She is one that would be a good friend and advocate for brain injury. So if any of you from the state of Washington, you might want to keep her apprised. This is the minority party leaders. Again, look and see if there are people from your state, for those of you outside of New York. These are the standing committees for the Senate. They're very similar to the House. Again, appropriations, armed services committees. The Health, Education, Labor, and Pensions Committee is often referred to as the HELP Committee. That is chaired by Tom Harkin, Senator Harkin from Iowa, who shocked everybody by saying he wasn't going to run again, but I think it's to do with his age. He's getting up there in years. He also chairs this same committee on the appropriations. So he will handle, as chair, legislation that comes through, that's the TVI Act. Of course, on the TVI Act, we've asked him to be a sponsor of the bill, and Orrin Hatch as a ranking, you look at your ranking members. When you look at committees, if you go into your committee listings, you'll see the chair. The chair is always of the same party that's the majority party of the body. So in the Senate, all the committee chairs are Democrats, whereas in the House, all the committee chairs are Republicans. But then you have what you call a ranking committee, and that's the minority party. So you have a ranking committee member who's of the minority party, and they usually have what do I want to say, the years. They've been there the longest. And probably if their party were in control, they'd be the chair. So sometimes you can kind of see that as party switch in the houses, that people that were the chair become the ranking chair, and then as they switch back on the parties, they become the chair again. But again, that's a real critical committee because that's where all of the bills, the vocational rehab bill in this situation, the voc rehab bill comes through this bill because it's got education in it. It's got IDEA, special ed law. It's got the education for the elementary and school education bill, or the No Child Left Behind bill. It's going to have our TVI Act. It's going to have any of the kind of disability and health kinds of bills are going to come through that committee. And then again, you have a Veterans Affairs Committee. Again, that's where the caretaker or caregivers bill and training bill for family members caring for brain injury and came through that committee. Again, the appropriations subcommittees looks kind of familiar. We sometimes pay attention to the defense bill. Something that the Congress will do that's a little different than what we, a little different than here, is that they, at the state level, when I say here, is that you can include language, budget language in the bill. So you're giving the intent of the committee when within the appropriations bill. And we've been able to the last couple of years, for example, in the defense bill, put budget language in saying the Department of Defense needs to collaborate with state and local community agencies and private agencies around brain injury services. And then these are the committees. They're very similar to the ones I talked about in the House. Labor H, again, is the bill that is the one that gets hung up. Just on the legislative process, they can be introduced by any body, either the House or Senate, but all the revenue bills must originate in the House, and traditionally the appropriation bills also are introduced in the House. I did want to point out something that I found a little bit different than state law, is that in looking at federal legislation, if they are, if it's a bill to change something that's already in law, they do amending legislation. And at our state level, and I think most states are like this, they will repeal and reenact. So you'll see the section numbers repealed, and then they're reprinted again to reenact them, and they'll bold the new language and take out the old. And what I'm saying is, then you look at it, you can see the context that the bill's in. But with the federal government, with the House and the Senate bills federally, you know, you have to kind of go back and look at the statute and figure out how the amending legislation fits, because you don't see it in an existing statute. This is a nice little chart I borrowed from some group that I found on the website. I thought it was nice. You can look at how bills become law. I will say that for every rule they seem to have to govern their bodies, they have a rule to get out from under those rules. Something I found kind of interesting was the committee situation. That's been discussed a lot lately with the Senate. They have not been going through the committee process. They've been taking bills directly to the floor. So like I said, it seems like for every rule there's another rule to get around that rule. But when you've got time, you can look at that. I did want to touch on the appropriations versus the budget situation. Budget has to deal with determining how much income is coming in and how much can go out to programs. So the House and the Senate are supposed to pass resolutions. You know, first the President submits his budget, as I talked about earlier, and then the House and Senate are supposed to agree to how much revenue do they think the federal government has coming in, what do they need to generate in terms of taxes, and how much do they have going out. And then what they do is they allocate that amount to the committees. So if they need to generate so much revenue, they'll give that to the Ways and Means Committee in the House, and they can look at the tax codes or whatever they need to do to generate that revenue. And then they kind of make a whole big item on money that they'll give to the Labor and H Appropriations Committee, and they'll say, this is how much money you have to divvy up with among the federal agencies. That is something that all the national organizations try to help with at the beginning of a session. You'll see letters go through from national organizations trying to tell Congress to give as much as possible to support health and disability programs, so there's some money to work with when they allocate. I want to talk too about the difference between discretionary and mandatory funding. I was so surprised last year when people would say to me they thought discretionary money meant, oh, it's just laying around and people have a discretion how to spend it. And oh, if that were only the case, it's not that at all. A discretionary means that that's money that has to be appropriated. They have appropriation authority usually, and they become in the annual 12 funding bills. So almost all health and human service programs, with the exception of the mandatory programs, are discretionary programs. So basically, if it's not mandatory, in other words, it's not Medicare, it's not Medicaid, it's not Social Security, it's not food stamps, all that are on a formula-based funding system, they are discretionary programs. They do have an appropriation that comes up every year. And so the fiscal year for the federal fiscal year is October 1 to September 30th. This differs from most states. Most states use a July fiscal year, but I think New York's the one exception that uses an April fiscal year. And I really wonder now in today's environment how state budget directors are even thinking about how to prepare their state budgets, not knowing what the federal budget's going to be, the flux that we're in, but they deal with it every year, I guess. In recent years, they've not been able to do their budgets on time, and again, it's usually the Labor H bill, maybe a few other bills, and so they'll roll them up and call them an omnibus bill, and it becomes a continuing resolution. And that's what the federal government's under now. They've got funding through March. They couldn't get a budget bill together for the majority of the federal programs to start October 1, so they rolled them up, and usually it's the same funding as the year before. And so the federal government then has to try to figure out how to continue things going, knowing that in March they have to start all over, not knowing what they're going to have in April. Sequestration's been all over the news. That is a whole long session on itself, but it basically means automatic cuts across programs. That is what people are trying to do now, is try to figure out how to balance the fiscal budget, federal budget, and then one of the ways they're looking at it is to cut across all the budgets equally, and that's going to have some devastation effects on many of our programs. And then just finally, our president has no line item veto authority. Many of the state governors do. They can go in and look at a budget bill and say, oh, well, this looks fine, but I'm going to take $50,000 out of this program and $1 million out of that program. The president cannot do that. This is a little chart, just if you're interested in looking at it sometime, how our money is distributed. I'd look to see if I could find a chart how much state government depends on federal, because in our state, education and Medicaid are the biggest pieces of funding, spending, and it comes largely from federal government. So when Medicaid changes come about or education comes about, it affects the budget. So what about brain injury and Congress? So how do we work with Congress within these constraints? What are the issues and how can we advocate? We're fortunate with brain injury that we have a caucus, so to speak. Legislative caucus is our way to organize people around issues that they may support, and it kind of gives us a way to have an inside track to support things. So for us, we have a Congressional Brain Injury Task Force. It is chaired by Bill Pasquale from New Jersey, and we just got Tom Rooney from Florida to be co-chair. And in case you're wondering, he's of the Rooney family that owns the Pittsburgh Steelers. So he has an interest in NFL football. He was previously on the Armed Services Committee. He has an interest in military, so I think he'll be a good co-chair. There are two other caucuses that sometimes we relate with. One is the Bipartisan Disability Caucus that kind of deals with the broader disability issues, and the Neuroscience Caucus that does with science research. And so the Congressional Brain Injury Task Force has actually had a co-briefing set up with the Neuroscience Caucus at one time, and so there's some opportunities to work with these other caucuses to promote our issues. For the coming year, of course, we have the TVI Act reauthorization, and it has not been introduced yet. For those that you may not know the TVI Act, it is the bill that was passed in 1996 that sets some money specifically for brain injury. It provides authority for appropriations to the Centers for Disease Control and Prevention around data collection, prevention, injury control. It provides funding to Health Resources and Service Administration for state grants to improve systems and to protection advocacy services to be able to do client advocacy. So that is the one piece of legislation that specifically addresses brain injury. And it is up for reauthorization. It expired last fall. We thought we could get it passed last fall, and then other things kind of superseded it, and it kind of got put on the back burner. So now that we have a co-chair of the Congressional Brain Injury Task Force on board, Amy Kohlberg with the Brain Injury Association of America and Rebecca Wolfkill with NASHIA are both working now to try to get the bill drafted so we can get it introduced soon and get that on the fast track. Certainly appropriations is something we're all interested in with regard to these programs to fund not only those programs, but we're interested in the funding for NIDER model systems grants, research and training center grants, and anything that can help us further offer further services and supports to people with brain injury. The CONTACT Act is going to come back up again. We had a call last week from Representative Pascrell's office and said that Senator Mendoza, I think I said that right, Mendoza from New Jersey was interested in introducing it. Again, it's to set up some grants to help states develop guidelines, help with developing the guidelines around sports concussions. You know, about 40 states have passed legislation now establishing guidelines or return-to-play guidelines or requiring return-to-play guidelines for people, for kids participating in sports. So this is sort of a federal piece of legislation that kind of helps CDC to help with the guidelines and provide grants to states to help them implement some uniform guidelines. So I do know that's going to be introduced.
Susan, we have a
control initiatives
Susan
now. Okay.
Susan, we have about 20 minutes before question and answer session.
And the gun control initiatives are being addressed now. I just want to point out that there is a provision in the President's recommendations with regard to CDC and NIH around research. That is something that Congress had prohibited over the last 20 years. They want to look at that. And then you might look at some of this listing of the bills that are up now. The Violence Against Women Act is being addressed in the Senate as we speak. Advocacy. Advocacy is so important in all levels, and I would like to hit some of the highlights of this. We can all be advocates on the individual level. Certainly, we have the opportunity to visit with our congressmen and women and senators. You can do so in your Washington, D.C. office, set up meetings to do that when you're in D.C., but you can also do that in your in-district. You can call and see when they're going to be in the district. Is there an opportunity for a meeting? See what kinds of opportunities you may have to be able to engage with them. My previous congressman had a listening tree, and I'd get these phone calls all the time to say you can now be connected to your congressman and have a time to interact with them. Email and phone calls, I will just say that don't do snail mail because they check it for anthrax and it just gets delayed. So these are ways that you can make contacts and ask others to help you as individuals to do advocacy. Organizations like the Brain Injury Association of America and certainly the BIAA in New York State, NASHIA, all identify priorities, set legislative agendas, have a grassroots advocacy network for calling people, putting out information, action alerts. So if you want to know what's going on, you can contact any of these groups, and I've listed the resources at the end to see where you need to be in the mix of making those phone calls. Coalitions, NASHIA, BIAA, both belong to a lot of national coalitions. It gives you more people to engage in the issues. You can do that at the state level as well. You have a wealth of groups within the states, whether it's the Development Disabilities Councils, the VR councils, etc. Associations, your state medical associations, hospital associations, all these people you can enlist and ask them, will they write letters on your behalf to Congress? Can you come to their meetings to talk about brain injury? Can you put an article in their newsletter that gets to their members? And that just broadens the base for you. And I would say personal and political. You never know where people are going to be. When I look at our congressional delegation, almost all of them served in the state legislature or were elected official before. So your relationships you build today can help you with your relationships tomorrow. I have given a document that's going to be posted that goes through this in more detail on how to write and communicate and how to ask for meetings with staff and how to visit with staff on phone calls. They're all just pointers. on how to engage. Okay, now I get to have another poll question. After all of this, do you plan to contact your congressional delegation now that you have learned more about the issues, yes or no?
The poll has been launched. Please take a moment to answer. All right. I will be closing the poll and sharing the results. All right. So 90% said yes. 10% said no.
Wow. Wow, wow, wow. I'm hoping, am I back? Yeah, I'm back on. Well, good. So I'm going to give you some upcoming opportunities. We do have our Congressional Brain Injury Task Force Awareness Day. I cannot tell you how critical our task force is. They not only co-sponsor legislation, they help us circulate letters around supporting funding. In a previous administration, they had our program zeroed out, but because we had 77 members on a letter supporting funding, it got through. So we have a day to do advocacy. They do all kinds of things to promote brain injury. So if you are attending, you can certainly arrange Hill visits. You can invite your delegation to attend the events. I will tell you that a lot of staff people come and the first thing they'll say is, do I have anybody from New York? Do I have anybody from Missouri? They want to know if their constituents are there. If they're not attending, you can arrange a call-in day, and Judy Abner told me that she is organizing that for your state of Missouri, New York. So you are ahead of the ball game on this, and you can stay tuned for information from her. If you're not from New York and you're interested, you might want to contact your affiliate, your Brain Injury Association affiliate, or others to organize a call-in day that day. And the last thing you can really do is ask your rep or senator to be a member of the task force and let them know that you have information about brain injury and resources and what a great person you can be to help them to understand brain injury and help them with their constituency issues. And so here are some resources. This again will be posted. You can track and see if there's some position papers that will be helpful, or if you want the latest information on the status of stuff. The Brain Injury Association is much better about putting out their weekly newsletter than I am, and that's all on their website. The bottom listing, the Thomas website, is where you can go and track legislation. It is where all the legislation is for Congress. You just put in brain injury or whatever topic you want, and it'll pull up all the bills that have been introduced. So you can see the bills that have been introduced, you can read the text, you can look to see where they are in the progress. So that is a tracking system that's available to everyone, and I use it all the time. It's the best. So my last question is, how will you, now that I have 90% of you saying you'll contact your people, how will you plan to do that? Do you plan to arrange a meeting? Do you plan to write a letter or email? Do you plan to make a phone call, or do you plan to help others to make contact? And I don't know if they can say I'm going to do all of those or if they just have to pick one. So you'll have to help me with that.
I did just use those 4 choices. The poll is open, so please take a moment to answer. I should have included all. That would have been a nice choice. All right. I'm going to close the poll now and share the results. It looks like 17% answered arrange a meeting, 52% answered write a letter or an email, 4% said they would make a call, and 26% said they would help others to make contact.
Excellent, excellent. And I'm assuming some of you probably could have checked off 4 or a couple of those, but this is great. This is what we need to do across the country, so we're unified. We need to have a unified action in terms of brain injury so that we are conveying this sense of urgency for the people that we want to support and provide some supports and services for. I'm going to give my little commercial plug on the Brain Injury Association of New York State and upcoming webinars, and I'm going to flip through those, and I believe the next part of the program is for people to ask questions.
Yes, we do have several upcoming webinars, including another webinar that's part of this advocacy series. So stay tuned. Continue to check our website, www.bianys.org. We have some wonderful resources there as well. So please check out our website. We will be, again, recording this and posting this along with the wonderful resources that Susan provided today and she mentioned during her presentation. And if you are on my webinar email list, you will get the flyers. If you've attended a webinar in the past, then you are on my list, so you will be hearing from me. I hope you enjoyed the webinar. We will be reserving some time right now for questions and answers, so if you have a question for Susan, please enter it in that question text box, and we will turn the floor back over to Susan.
Okay, so we're waiting on some questions.
We're waiting on questions.
And if there's something you want me to go over, I do talk fast. I know I do. And if there's something that wasn't clear, be sure and just ask it again. I think for a lot of folks, advocacy or contacts with Congress or all, there tends to be a, oh, I'm not going to be involved kind of attitude. And I'm so happy to see that we don't have that attitude on this call, because the truth is there isn't anything that we're involved in that doesn't have some relationship with Congress or state law even, whether it's the air we breathe or the water we drink. Everything is kind of regulated and dictated that way. So we all are invested in how we live and what government needs to be doing for brain injury. We all have personal stories. So if you are a person with brain injury, certainly your personal stories are very effective in galvanizing people to take some action and help us move the field forward. If you're a professional, I would say the same thing. You have the stories, you have the expertise, you're a wealth of information. So everyone has an angle and everyone has a story to tell, and that's the most important thing to do, is to tell what your story is, what you think would be helpful in your state, and give some specific examples.
I do have a question. I have one question about the PowerPoint slides. Yes, we recorded this webinar. We will be posting the recording with the slides, and there are several other resources that go along with this presentation that Susan provided. So we will be posting all of those materials. I anticipate we'll have them up by the end of this week. If they are not up by the end of the week, then please check our website in the beginning of next week. But I do anticipate having them posted by the end of the week. We do actually have a question from the audience, Susan. Is there a particular format to use in writing a letter or email that people with cognitive issues can follow?
Yes, and that will be posted. I kind of went briefly through that on the slide, but I did put together how to communicate. I think that's the name of it, in that materials that Carla's going to post, because there is a format. You certainly want to include your address. You certainly want to keep it simple, talk specifically what you want them to do, support a bill, for example, or support something. What is it you want them to do, why you want them to do it, and thank them for doing it. Form letters do not work well. People do not like form letters. And so what I did is I put together on how to write and how to communicate with your congressperson. So when that gets up, look at that and see if that helps. And if that doesn't help, I can certainly draft some examples for you. And I use email for commuting quite a bit. I find it easier. All the Congress people and all the members of Congress and senators will have email, and they will take letters from their constituents. Most of them will only take them if you're from their area. So when I write my congressperson, it wants the zip code in there so they can see I'm a constituent. And that's how I communicate it. And then I get an answer back. I mean, they follow up.
I have another question. How can organizations that are restricted from lobbying advocate for legislative change?
That's a good question, because most of us are nonprofits, work for nonprofits, and we can't have political action committees or that sort of thing to do, and we have to watch our P's and Q's. But there are some things around that are in keeping with the IRS. One is public information. You can do public information, public education. You can do education to members about the status of things. You can actually do action alerts. You just have to be careful how much you do that way. Where nonprofits can't do is really donate to campaigns. Now, individuals can. I certainly have individually, but most national organizations that are nonprofit, or most organizations that are nonprofit, are restricted into actually donating for campaigns. So that's the things that you have to watch, and you just have to watch how much of your resources are involved with actually advocacy. But there's a lot of leeway in terms of public education information materials that are put together. The federal government has a little bit more restrictiveness because of Congress, who has put some language into the federal budgets around federal money being spent for advocacy. So if you have a federal grant or you're using a federal grant for some of that, you may want to check with your federal agency that's involved with the contracting to see specific what they will allow with federal dollars. But that comes from Congress. The other piece is the IRS. You don't want to jeopardize your nonprofit, but you can still do some advocacy. You just can't do the fundraising, and you can't do political contributions. Does that help?
I thought that was a good response. I have another question. What forms of advocacy are most effective? I have heard, this individual says, they have heard that legislators are more likely to read emails rather than written letters, and I think you mentioned this before, to avoid the snail mail.
Yes, I mentioned the snail mail because ever since we had the anthrax and the different things with Congress, you have all those security issues at the Capitol. So snail mail doesn't work. Faxes will work, emails will work, faxes will work, phone calls will work, in-person stuff will work as well. Another thing I mentioned on nonprofits, there are things you can do too. You can invite your Congress delegation to if you're a provider, for example. I think there's some health professionals on there. Invite them to your program and look at the program. You can invite them to meetings and give speeches and talks. You can give them an award or certificate and thank them for the work they've done on brain injury. And all of that is a way to establish relationships with members of Congress, make them aware of brain injury, and then they have a connection to you. So there are some things that you can do within the district, that at home particularly, that helps promote them and makes them have a contact with you. Give them an award, give them a recognition, have them be a public speaker. So you can do some other things if you can't, give money to their candidacy.
I do not have any other questions at this time. Judy, did you want to take over?
No, I wanted to ask a question. I don't have a text box. Sorry. But I know, Susan, I wonder if you would comment on meeting with a legislator, him or herself, versus meeting with staff. I know when I have done visits both in the state and on the Hill, and when I've gone with other people, folks are often disappointed that they don't have the opportunity to meet with the elected representative, him or herself.
Right.
So I wonder if you might comment about that.
Yeah, I will comment on that, because in my early days of going to the Hill, it was back in the 80s, and I worked for development and disabilities then, and I would see my congressmen and women. It just, I met Gephardt, I met with Bob Young, I met with all of the key players, Ike Skelton. It wasn't their staff. But in more recent years, in the last 15, 20 years, it seems like it's always staff. And at first my nose was kind of bent out of joint, because that's not how it used to be. And then I found out from working with Jean Barabay and then Rebecca and the others that are on the Hill, that people are so busy now that if you've got the right staff person, if you've got their chief of staff or the staff that's involved with health or disability, they just said, don't worry about it because they're the ones that's going to decide and help the congressperson decide on positions. So you don't need to have the direct contact with the congressman. If you've got the staff working with you, they can make it happen. So on our brain injury legislation, for example, it's the staff that Rebecca and Aideen has been meeting with out of Harkin's office. It's his key staff. It's the key staff of Appropriations Committee. And they're the ones that, I don't want to say they make it happen because they're not the elected official, but they are the one that has strong influences. So even if you have to meet with staff, I should say have to, if they set you up with a staff person, you know, that's great. Make sure it's a key staff person that's dealing with health or disability issues, not just constituent issues, but issues that deal with the topic so they can make an impact.
And related to that, if somebody is reaching out to a congressional representative or senator in the local office,
right.
In other words, not in their Washington, D.C. office,
right.
but in their offices in New York, for example,
right.
there would be staff people as well.
Right. And they can be very helpful. And in fact, I will tell you this, some of the issues that I have written to D.C. on, it's been the local person that will call me and say, what is it that you're needing? And or I've had the in-district, I won't say local, but the in-district staff will call and say, Congressman so-and-so has this constituent issue, can you help? So that's their kind of boots on the ground kinds of people back within the state. And those folks also can tell you what the agenda is when they're in town. I mean, I must be on everybody's list. I've been invited, you know, the Chamber of Commerce will have a breakfast for the congressman, and I've gone to those breakfasts. Or they'll have hot dogs in the park, and I've gone to those. Or they'll have a listening post. You know, they're out and about when they're in the district, and if you develop those good relationships with the office within the districts, then you have a sense of when they're back in the state and when you can visit and get their attention and get to know them.
So I think the important point is for people to remember that there are home districts.
That's
and
right.
one way
That's
to
right.
really underscore that you are a constituent
That's
is
right.
by doing the outreach and trying to meet with the elected official or his or her staff in their home districts. It's not all about only traveling to Washington, D.C.
That's
but
right.
it's
And in that
also
listing that
about-
I've given you to post, I've listed every one of your home districts.
Mm-hmm.
I even know the ones that are closed from the hurricane. You have a lot of congressional members to type up.
We do.
27 of
In New
them.
York, we always have an embarrassment of riches.
You do, you do. But I will also say, it's what I said earlier about your relationships. You never know who today can help you tomorrow. So, you know, I just feel like politics and all of this is a people business. And, you know, educate the staff. They can help you tomorrow. You don't know where they're going to show up tomorrow. And district staff today could be in D.C. tomorrow. And legislators that you have at the state level could be in Congress tomorrow, because that's kind of the training ground for our state. They start out here first. I've known our two senators for 30 years. They were elected officials here first in Jefferson City. So we like to say to people, get to know and develop relationships before the craziness of the sessions. So, you know, in the summer times or when they're campaigning, we just had election, perfect time to meet and greet people and get their attention, so you form those relationships early. And if you don't have them, see who else has them in your cadre of friends. Or some of the things we've done, Judy, in the past, you know, I live in the past, but back when we were trying to work on the TVI Act, I got the Speaker of the House and the President Pro Tem to write a letter. I actually wrote it, but they signed it to our congressional delegation to say this is important to Missouri. We spend state money. We don't have enough resources. We need some federal support. So you don't know who you might have within your existing cadre of people that can help promote your interest. I mean, even in the governor, we did have state offices in D.C. that lobbied on behalf of the state. The previous administration cut that funding. But under a couple governors, I got contacted and said, what is your priority legislation? Well, one of the governors put Medicaid and brain injury funding as his top 2 priorities. And guess what? The state office in D.C. called me and said, what's this about? So think about your network of people, not just always the people you deal with the Brain Injury Association, but who else do you know? And I know, Judy, you're quite an advocate at the state level with your state legislature. Who within those state legislature are good people that can help you have access to some of these folks?
Well, and the other thing is just to remind folks who are on the webinar that the first webinar in this advocacy series was one about basic skills. It really, Susan, reflects some of the tips you gave. And so if people have not seen that, you may want to go back and look online, look at those slides, which underscore a number of the points, not the least of which is a cartoon that says something basically about making friends before you need them.
Right,
and that,
right.
that
was my point.
The biggest take-home message is, as you said, is about the building of relationships and all. And I just wanted to say that Susan mentioned that we are planning to put together something we're calling a virtual Brain Injury Awareness Day. And we will be putting together a packet that will be available through our website of resources, of ways of contacting folks, and of talking points, which basically, again, try to engage as many people as possible from your home. You don't even have to travel anyplace to be an advocate and be involved in advocacy. And really try during March, which is Brain Injury Awareness Month, to really become a visible advocacy force on the national level and also on the state level.
And I'm sure, Judy, you will help them with the messaging. I think one thing to keep in mind, people's time is valuable, so you don't want to waste people's time. You want to have a message that's short and to the point. You're not disagreeable, you're not angry, but you have a message. And I've actually gotten caught on that once when I had a prominent person that set up this whole meeting, and then they said, well, where's your proposal? And I thought, oh my God, you know, I wasn't ready with a written proposal. I didn't expect it. You know, I expected to have the inroads made, but I didn't expect with, well, let me see it. And so be prepared, and I think, Judy, that's where you and the associations can help people be prepared, you know, on what you say.
Right. Well, that is our plan.
Yep.
So I would encourage people to stay tuned through email or checking our website for information about that. Carla, are there other questions?
There are no other questions. So at this point, if you would like to end the webinar session, I think we can.
Okay. Well, then just thank you very much, Susan, and thank you to everybody who participated. Have a great day.
Thank you. Are you all on for a minute? Did you hang up?